today we are looking at the neurotransmitters and also the about the hormones, and we are looking at the influence they have towards the feeding as well as the satiety center in the hypothalamus. So to begin with, the first question is neuropeptide Y. So what is this associated with? The next question is orexins, that is A and B. What is it associated with? The third question is the melanocyte. The melanocyte stimulating hormone. So that is nothing but the MSH. So MSH, what is it associated with? So in this video, we'll see the answers to all these questions, and in the end of the video, there is a bonus section as well. So to start with, the increased appetite. So what are the neurotransmitters, the hormones which are associated with this? So first is the neuropeptide Y. Next, it also includes the agouti related protein. So in short, it is known as the ARP. Next, there is also the melanin concentrating hormone. So melanin concentrating hormone, it is nothing but the MCH. Then there is also the orexins. Orexins, it is A as well as orexin B. Then comes the endorphins as well. Then comes the ghrelin. Then the galanine. And amino acids. So here under amino acids, there is the glutamate and the gamma amino butyric acid. Then also the cortisol. Next, we will look at there is the presence of GHRH. Is nothing but the growth hormone releasing hormone, that is GHRH. Then there is also the endocannabinoids. So this was about associations with the increased appetite. So increased appetite, it is nothing but the orexigenic. So now we are going to look at what is associated with the decreased appetite. So decreased appetite is nothing but the anorexigenic. So here there is the MSH, that is the melanocyte stimulating hormone. Then comes the leptin as well. There is leptin, there is serotonin, norepinephrine. Then we also have the corticotropin releasing hormone, that is nothing but the CRH. Then comes the insulin as well. Next, under the decreased appetite, there is also the presence of the CCK. CCK is nothing but the cholecystokinin. After this, there is also the glucagon. The glucagon like peptide, and there is also the cocaine and the amphetamine regulated transcript. So this is nothing but, in short, it is known as the CART, that is CART. Post this, there is also the bombesin and also the peptide YY. So now we are going to jump and answer our questions. So the first question we asked was, what is the neuropeptide Y associated with? So this is associated with the increased appetite. That is nothing but the orexigenic. This was the first question. The second question we asked is, in case of the orexins. So orexins A and the orexin B, what is it associated with? So here, this is associated with, again, the increased appetite. And this is nothing but, again, it is orexigenic. The third question we asked was, what about MSH? That is nothing but the melanocyte stimulating hormone. So what is this associated with? So this is associated with decreased appetite. So it is nothing but the anorexigenic. Next, we are moving on to the bonus questions. So these questions, we can answer it in the comments. So the first question is, where is the AGRP? That is nothing but the agouti related protein. So where is this present? This will be our first question. So what is it associated with? Increased or decreased appetite? So the second question is, insulin. What is this associated with? Third question is, ghrelin. Ghrelin is associated with what? Increased or decreased appetite? So you can answer these questions in the comments.